Welcome back to the Newsbeat Late Night, and we continue now with your reporting as the world gets ready to commemorate World TB Day on the 24th of March. We ask if COVID-19 is threatening the progress we have made as a country to combat tuberculosis. The executive manager of the South African National AIDS Council, Reverend Zwaitou Nebutaru, joins us now to tell us a little bit more. Rev, good evening, and thank you very much for your time tonight. To what extent does COVID-19 threaten the progress that we have made as a country in response to TB?
It is quite a big threat to it because a lot of the programs, especially outreach programs of tuberculosis, are not being done in the same way that it should. We have got a big task of trying to find people who are infected with TB and they are not on treatment. And because of COVID, it has been very, very difficult to try and find those additional people who needs to be put on treatment. But also that we are seeing the number of people who are defaulting on treatment also increasing. And so COVID-19 is actually impacting very negatively to our fight to end TB.
Now, talk to us about those numbers that you believe should be getting treatment and are not getting treatment at this particular point. How many patients you think are still out there that needs to be a part of the treatment program?
We are talking about patients. You see, it's an estimate, but we talk about thousands of people who are supposed to be on treatment who are not on treatment at this particular moment. In terms of the treatment cascade, I think we have got about over 100,000 people who are not on treatment at this particular moment, who are supposed to be.
Yeah. Now, when it comes to treatment of this nature, of course, there has to be significant work being done in tracking. And I know you've mentioned that finding the people, but not only that, finding a huge number of them and initiating the testing of those people, and then also beginning with the treatment. We've seen that as quite an effective way. For example, in dealing with COVID-19, they'll tell you that in Wuhan, that is the strategy that they used, tracking as many people as possible, using a whole lot of activity, which included technology as well. So what is the nation doing? What are the efforts that we're doing as South Africa as far as that is concerned?
If you look at what we're doing now, because you see the issue of technology really has not been deployed in terms of tracking people infected with TB as much as we have been trying with COVID-19. We need to be able to move into that particular space. But what we are doing at the moment is to mobilize the leadership of the country to be involved in dissemination of information, especially the political leadership. We're talking about the mobilization of legislatures as an example, but it is really incumbent upon every South African to make sure that they are part of tracing, tracking, and finding people who are infected with TB so that they can be put on treatment. We must remember that TB is completely curable, and we should not be having people losing their lives at the rate at which they are losing in the country. But also we should not be having people continuing to infect others, because the moment people go on treatment, it's a prevention of the infection rate actually increasing and being spread to other people as well.
Is that what you're talking about as a theme when you're saying a mutual accountability between leaders and ordinary South Africans, and why that approach is important?
It's very, very important because you see, South Africans or people in general, they listen to their leaders. But also leaders have a responsibility to lead people out of the difficult situations in which they find themselves in. And one of the very difficult situations that South Africans find themselves in is this TB epidemic that we face as a country. We have seen how leaders all over the world stood up and led the struggle against COVID-19 without any exception. And we have seen how that has been able to be, even though the toll has been great, but because of the stand of leadership, they managed to be able to find mobilized solutions and actually implement some of those austerity measures that we talk about, like lockdowns and so on. An epidemic that is confronting the country requires leaders to be able to lead also on that particular aspect because it is impacting on the people. But the leaders can't do it alone. The people should also cooperate with the leadership so that whatever measures are actually implemented can help the people themselves.
How far are we from hitting our targets, which we've set for ourselves for the National Strategic Plan for HIV, TB and STIs in the country, particularly looking at the period 2017 to 2022? I mean, we are a year away now from that deadline.
We were doing quite well before COVID, but at the moment, as I've been saying, there has been quite a setback. And when we look at the National Strategic Plan, you see it is becoming a little bit easier to be able to see great progress, for instance, on the HIV front than on TB itself front, especially when we look at these issues of searching for missing TB patients. And that has also been complicated by the findings that actually people can be infected with TB without any symptoms. So very much like part of COVID, it's asymptomatic. So we are working very hard around the clock, but it is becoming very, very difficult for us to be able to meet those targets by the year 2022 as we have set them up.
So, Rev, one could say, well, we could look at COVID-19 as, of course, an impediment to the work that we are trying to achieve as in a fight against TB, or we can look at it as an opportunity as well. Maybe there are lessons that we are learning in how we are managing this health disaster that could possibly help us scale up our efforts as far as the fight against TB is concerned. What are those opportunities, I mean, when you look at it?
There are some provinces, for instance, who have already taken a lead in, as you can say, latching on or leverage on those opportunities. For instance, when they go on massive COVID screening campaigns, they've also integrated TB into that. But also as a country, the way in which the country has united to actually fight this COVID pandemic has been unprecedented. And if we could be able to learn from that in epidemics, of course, like TB at this particular moment, that we are united. You see, the issue is that COVID kills people very, very quickly it has to kill people. And a disease like tuberculosis takes a while. And very often you read the statistics and it does not really shock the people that much. But it's incumbent upon the leadership to be able to continuously communicate the devastating effects of tuberculosis and also to lead on all the campaigns that are aimed at trying to deal with it and trying to end it. And of course, you have also indicated the issues of technology itself. I think we can learn from the many technologies which have been used in COVID. What is very also interesting is that TB, by the way, unlike COVID, is completely curable. So I think it is a matter of making sure that we find people on time, and those people are then put on treatment. And when they are put on treatment, they actually adhere to the treatment, and they can be cured completely, and also not be able to spread the infection. But the other issue is the issue of resources, of course, that we have seen that on the COVID front, a lot of resources were thrown into it in a bid to stop it. I think as a government, as a country, we should be able to have more resources dedicated to pandemics or epidemics like TB and HIV and AIDS. And we have seen that it really works. So I think it's important for us to also be able to do that. And COVID has been the responsibility not only of government, but we have seen how the private sector came to the party as well. So this multi-sectoralism that has been very much at the forefront of COVID, we can also be able to latch onto it and make sure that we mobilize the leadership across the sectors of society to be able to stand up together and be more resolute to end the TB epidemic.
Right, Rev, as we wrap up, give us a specific activity, awareness activity from the SANEC side that you have planned for tomorrow.
Tomorrow, today, this evening, we had a dialogue with sex workers. We just finished it now. In fact, you caught me as I was trying to leave at the moment. But tomorrow, we are going to have, of course, the main address of the Deputy President. There will be also services that are going to be delivered around Nhlanzeni and in other places. We are also going to have what we call policy in action activities that are going to take place at the townships, surrounding townships here like Kabukweni, hosted by faith-based communities, people living with HIV and AIDS. We also have people with disabilities. So there are a lot of other awareness activities which are planned for around here. But this is not only here. There are many, many activities which are planned all over the country. We have developed the concept. We have sent out the theme there. The clock is ticking. It is time now for us to work together to end TB. And in communities, there are many other activities which are going to be taking place tomorrow and in the months that are coming around TB, HIV, and STIs.
Rev, I appreciate your time. Thank you very much for joining us tonight. The Executive Manager at SANEC there, Reverend Zwetaho Nebutaru, there, as he's packing up following that dialogue.